Good afternoon, everyone. My name is Fahad Shahid, and we are live from Prime Hospital page. I welcome you to another awareness session organized by Prime Healthcare Group. As you can see, the heading of this today's webinar is actually it's about prostate cancer. I have before I start, I just wanted to tell you, prostate cancer is cancer that occurs in the prostate. Prostate cancer is one of the most common types of cancer. Prostate cancer is the second most frequent malignancy after lung cancer in men worldwide. Just wanted to tell you, 3.8 of all the deaths caused by cancer in men in 2018 were actually because of a prostate cancer. I have with me our guest speaker today, Dr. Sanjay Bhatt, who is consultant urologist, one of the finest doctors in the country in UAE with us. Dr. Sanjay's expertise are laparoscopic, urological, constructive surgery, and uro-oncology, stone disease, medical and minimal invasive management, prostate diseases, medical and minimal invasive management, pediatric urology, and congenital anomalies, and the list goes on. Dr. Sanjay, thank you so much for joining us. We welcome you to the webinar. Thank you, Doctor.
Good afternoon, Fahad. Nice to be with you.
Thank you so much, Doctor. Doctor, what do you have to say before I come to the main topic, Doctor? I just wanted to talk about men's health. What is the importance of men's health? If you can just give an overview, and then we'll move on to the main topic. Thank you.
Okay. See, you must have seen the awareness programs in the last few months about pink, breast cancer, and a lot of worldwide traction on that. And it has given so much importance, and it has led to so much change in the management of breast cancer. You get early breast cancers, you can cure breast cancers now. Unfortunately, men's issues have not got the same amount of traction. And this month is a men's health month and the prostate cancer awareness month. So I think it's very important for men's issues also to be handled. That's why I think men's health is important. Why is it important? Because we all know that times have changed, lifestyles have changed, environment has changed, the work culture has changed. I mean, people are at work all the time. They don't have time for their men's health. And what is this men's health? Well, because of poor lifestyle and habits, there's more and more of obesity. More and more obese men are there. And obesity itself and diet itself has its own problem on men's health. There is more of erectile dysfunction, impotency, and also more of prostate cancer, which is probably related to a sedentary lifestyle with unhealthy diet. Men's health also includes, sexual health and prostate cancer awareness. So it's an overall thing. The overall well-being of the man is sexual, urological, and prostatic health.
Great. Thank you so very much, Doctor. That was an overview on the importance of men's health. That is really very important. Doctor, what are the most crucial topics overall which men at all ages should know about?
Well, as I said, the most crucial thing is overall healthy lifestyle. There is more of smoking, there is more of alcohol, there's more of unhealthy diet, and less of exercise because of probably professional commitments, and people are just too busy at work. And this leads to a whole lot of issues, not only with regard to the men's health, but if you look at impotence or erectile dysfunction. If a younger man gets erectile dysfunction or impotence, we don't focus there. Because after all, an erection is because of a good blood supply going to the male genital organ. So obviously, if somebody is not getting good blood flow to a male genital organ, probably other organs in the body are also not getting blood flow, like the heart, like the brain. So this guy is probably at a potential risk for a heart attack or a stroke or something like that. So we just don't pass off erectile dysfunction as an erectile dysfunction. We have to overall assess the patient, probably even send him to a cardiologist to evaluate him whether he's at a potential risk for a heart attack or a stroke.
Doctor. Doctor, coming to the main topic, that is very important as we are talking about prostate cancer today. Uh, about prostate cancer, Doctor, what is actually prostate cancer? People would really, I'm sure there are people who do not know where the prostate is, and I would really like you to just give this information on this.
Okay. Well, we all have a urinary bladder, and men have a passage going out to the exterior called the urethra. Just below the urinary bladder is a walnut sized gland called the prostate gland. Now, the function of the prostate gland is to produce seminal fluid and to store seminal fluid in a nearby sac called the seminal vesicle. This prostate functions entirely under the control of the male hormones, and it is a normal aging process that the prostate starts enlarging from the age of 45. And after that, after 50 or after 60, it is also the second commonest site for cancer developing in the body. So this is the importance of the prostate, and everybody, every man and everybody with male relatives should know about this gland.
Right. So it's a gland that is, Doctor, who are at risk?
See, now prostate cancer has got environmental, geographical, and familial factors which are responsible for it. For example, if you go to the Western countries, like you go to United States or Europe, the incidence of prostate cancer is much higher than what you would see in the Middle East or the Indian subcontinent or in the Far East. So obviously, it's something to do with genetics and environment. For that matter, if somebody from the Far East or the Indian subcontinent migrates to the West, and then is exposed to the environmental, the new lifestyles of the West, the next generation of men in that family are at a higher risk than the native place from where they have come from. So this is an important factor which has been noted worldwide. Second thing is African Americans are at a much higher risk of getting prostate cancer at a younger age, as well as it is more aggressive in this genetic population. The next thing is if you have a family history, a brother, a father, or uncle, or somebody who has had prostate cancer, you are at an increased risk of having prostate cancer. So basically, people with a family history have to screen themselves for prostate cancer on a regular basis. And as I mentioned earlier, the lifestyle, the diet, there are definite relationships between diet and various cancers, like plenty of fatty and red meat like sausages, bacon, ham, pork, meat and beef and things like that probably have a role to play in many cancers. Whereas in the Middle East, in the Indian subcontinent or the Far East, there's a more holistic sort of diet with a lot of vegetarian incorporated. So maybe that is one reason also why there is less of prostate cancer in these regions.
So, Doctor, what are the symptoms of it then for prostate? Because that is something very, very important. People sometimes go to Google Doctor, or some here and there they'll go with unauthentic, I should say, non-authentic information. So, what are the symptoms, if you can just give it?
Yeah, first, I don't think anybody less than the age of 45 should consider himself to be at risk for prostate cancer, unless he's an African American with a family history. So, as I mentioned, the prostate surrounds the urethra or the urine passage in the male. But the prostate cancer develops in the outermost part of the prostate. So, sometimes by the time it enlarges sufficiently to obstruct the urinary system, it may be too late. So, most often, prostate cancers may have no symptoms at all, and they are detected during a routine screening evaluation by a urologist. But as they enlarge in size, they may have difficulty in urination, the flow of urine may reduce, it may be interrupted, you may feel incomplete emptying of urine, you may want to go frequently, you may have burning sensation, you may have to get up more often at night, or you may even have blood in the urine and in the semen. So these are the local symptoms that prostate cancer can produce. But when it extends outside, the stage of the disease, when it increases and extends outside the prostate, it can infiltrate the nearby organs like the bladder, causing blood in the urine, or the rectum, producing constipation, or it can spread most commonly to the bones of the vertebra, and you can start getting backaches, you can get fractures easily, or it can go to the liver and produce jaundice, or even to the brain and produce, fits and convulsions. These are the usual symptoms.
Thank you, Doctor. Doctor, what should people at risk do about it? As you said, the symptoms.
See, the most important thing is awareness. Anybody who has urinary symptoms, especially when they are around the age of 50, should visit a urologist and have a physical examination and a PSA test. A PSA is a simple blood test done which can give us some suggestion that there is a possibility of prostate cancer. So there is a cutoff limit for PSA of around 4, and of course it is age related. As the age increases, the cutoff limit also goes up. But combined with a physical examination, we can detect prostate cancer in a majority of cases. Now these cases, what I talked about, are those patients who have urinary symptoms. But on the other hand, if you are 50 or 50 plus and you don't have urinary symptoms, it is entirely up to you to decide whether you want to screen yourself for prostate cancer by just having a physical examination and a blood test at least once a year or once in 2 years. It is definitely going to do you good. But if you have a family history of prostate cancer, it is mandatory. From the age of 45 for blacks and from the age of 50 for non-blacks, they have to have an annual physical and PSA estimation.
Doctor, talking about what happens, what are the, if it happens, what are the treatment options for it in case if prostate cancer happens?
Well, as I said, first we visit the urologist and diagnose it. How do we diagnose it? It's an outpatient procedure whereby we do a transrectal ultrasound guided biopsy of the prostate. It's done under local anesthesia or maybe a minimal amount of sedation if the patient is apprehensive. And we get the report and confirm with the pathologist that this patient has prostate cancer. And we know which type of prostate cancer. There are different gradations of prostate cancer. Once we know that the patient has prostate cancer, our next aim is to stage it like any other cancer. It goes through stage 1, 2, 3, and 4. Now, what is stage 1? Stage 1 is when the cancer involves less than 1/2 of the prostate gland. Stage 2 is when it involves more than 1/2 of the prostate gland. Stage 3 is when it goes outside the prostate gland. And stage 4 is when it goes to distant organs like lymph glands or liver or bone or brain or structures like that. So the first thing we do is diagnose it. Second thing we do is stage it. How do we stage it? Modern imaging like MRI, PET scans and bone scans, nuclear bone scans, are used in the staging. So once we find out which stage it is, the treatment varies. But I want to emphasize at this point, the importance is that prostate cancer is a very, very slowly growing disease. So if you detect it early, you can get very, very long-term successful cure rates with this illness. I mean, I'm talking about 25 to 30 years of longevity if you pick it up early, almost a cure. Whereas this curable stage is probably in the first and in the second stage. In the third stage, probably we may not cure the patient, but as the condition is relatively slower in progress than other cancers, with modern treatment, we can give long-term, comfortable life span to the patient. Now, what about stage 4? Even in stage 4 patients with modern advances in chemotherapy and hormonal treatment, significant improvement in lifespan of patients are achieved. Now, the treatment depends on the stage. Stage 1 and stage 2, where it is still confined to the prostate, are treated either surgically, what we call as a radical prostatectomy, where we remove the entire prostate and nearby lymph glands, or by radical radiation therapy, where the entire prostate and the nearby lymph glands are subjected to radiation. Now you may say, which is better, surgery or radiation? Most studies show that both are equally effective. So for example, if you come to a surgeon, we would be biased towards surgery. Whereas if you go to a radiation oncologist, he may be biased towards radiation. But one should be aware of the pros and cons of both forms of treatment and make a educated, decision on which type of treatment to take. So coming to surgery and radiation, both have undergone tremendous advances. In the convention, surgery was an open operation where we used to open and take out the prostate and the lymph nodes. Then in the 90s, it progressed to laparoscopic surgery, that is through keyholes. And now it has progressed to robotic surgery, where the same keyholes are used, but a robotic console controls these instruments. And the surgeon is not at the bedside, but he is at the computer console. So this is how surgery has progressed. And obviously, with keyhole surgery, the recovery of the patient, the cosmesis, the postoperative pain, the amount of bleeding, needing transfusions, has all reduced and improved tremendously. So nowadays, most centers in the world who do surgery do it either through a laparoscope, or if you have access to a robot, is done through a robot. So the patient is in hospital for 2 or 3 days and he's back to work in about 2 weeks. What about radiation? Radiation also has undergone a whole lot of advances. In the past, when these high doses of radiation were given to a patient, a significant amount of radiation used to go to the nearby organs, starting from the skin till down into the rectum. And there were a lot of side effects and a lot of hesitation of patients and bystanders and relatives to go for this treatment. But now with modern imaging and computerized technology, the exact day-to-day position of the prostate can be targeted each day of radiation, so that the maximal dose is given exactly to the target area with minimal spread of radiation to surrounding structures. Unfortunately, the difference between surgery and radiation is radiation takes a longer time. You may have to have 6 weeks of radiation involving visits to the center, 5 days out of 7 days in a week. Each session may take 10 or 20 minutes, but it doesn't affect your work or your anyway, and you just go and come back. Now, when it is stage 3, that it has gone beyond the prostate, and even when you treat with radiation, as I mentioned, prostate cancer is highly dependent on the male hormone called testosterone, produced from the testicles. Now, in radiation treated patients, we may have to give them 6 months to 2 years of hormonal treatment to block the testosterone production during this period. For patients who it has gone out of the prostate, obviously surgery cannot remove it anymore, because whatever surgery you do, something will be left behind. So patients where it has spread beyond the prostate, we treat the whole area with radiation in combination with hormonal treatment. And finally, stage 4, where it has spread outside. Here in these situations, once again, there's no point giving local treatment to the prostate by surgery or radiation. Like you can't close the barn door after the horse has run away, as they say. So what we do is we treat them with systemic chemotherapy or modern hormonal therapy, and newer treatment, including cancer vaccines, are now coming into the under study, and they are being researched upon to treat these patients. But even in these patients, the longevity is better than that of non-prostate cancers.
Right, doctor. Doctor, that was very detailed information from stage 1 to stage 4 about prostate cancer, and I believe our audience would really got a lot of information on that part. Doctor, what is the importance of screening? That is a very, very important question, I believe. As you said, one thing I would like you to add in this is, if is it seen in ages 45, before 45, as you just mentioned that, just you mentioned the age 45 and above, and if a person is above 45, what is the importance of screening, and how much in the time frame they should be doing?
See, the thing is, when patient is below 50 or so, unless there's a family history, we don't screen for prostate cancer. Now, suppose it's a government program like a prostate cancer screening program, or it's it turns out to be very cost ineffective. In the sense, you screen every male after the age of 50 with a PSA and a physical, and you do all these things, and you end up doing so many biopsies, and ultimately the number of cancers you would pick up is actually very low for the amount of investment made in the form of doctor's visit, PSA and biopsy. So prostate cancer screening cannot be recommended as a national policy, but I would say that it entirely rests with the patient to be aware that if he is conscious about this, it is good for his health. If he just goes and has a physical and a PSA at least once in 2 years after the age of 50, it is possible to pick up cancer in a very early stage. So that is the importance of screening. And every patient who is symptomatic, that is, who has difficulty in urinating either due to obstruction or due to frequent urination, when he visits a urologist, will have a PSA test along with a physical. Non-symptomatic patients, the choice is theirs. But as my advice, anybody who's aware and who's capable of doing these tests should visit a urologist and have an opinion at least once in 2 years after the age of 50.
Thank you, doctor. Doctor, in your answer, you just in the beginning you mentioned that we don't recommend doing screening tests unless and until you have or have family history. Now, talking about the family history, is it the prostate cancer family history or any other cancer family history you're talking about?
No, I'm talking about prostate cancer family history.
Okay, so
because many patients will come and tell me that I have a family history of prostate, so I want to do a PSA. When you ask them exactly what they mean by that, it may not even be prostate cancer. It may be just a prostate enlargement. You understand?
Okay. So
and prostate enlargement is universal. Somebody in the family is obviously going to have it depending on how long he is going to live. So it is prostate cancer in the family which increases your risk for developing prostate cancer.
Doctor, I just wanted to ask you one more question. Is itching near to the rectum or anal, is it a symptom of prostate cancer?
No.
No.
Okay. But when you have pain or infection in the prostate, it can also have discomfort in the anal region and rectum, because those organs are all closely in approximation and they have the same nerve supply.
Exactly. So, doctor, the discomfort means pain or stuff like that?
Yeah, pain or irritation or something, but not itching.
Not itching. Okay. I have a question from Dr. Astia. She's saying which PSA is good and good to do, total PSA or free PSA?
Actually, it is total PSA that is done for all patients. Now, once the total PSA is done, suppose the value is less than 4, we pass it off as normal. Though you can split hairs and bring it down to even 2.5, which is done in many Western countries. When the PSA is more than 10, it has to be investigated with the form of an MRI and a prostate biopsy. Now there is a gray zone between 4 and 10. This is a borderline zone. So in these situations only we do a free as well as a total PSA. And we see the ratio of the free is to total PSA. If it is less than 15 to 20%, then there is a higher chance of prostate cancer. So free and total should not be ordered routinely at the first sitting. First a total PSA is done. If the PSA is more than 4 and less than 10, then we go for a free PSA. If it is more than 10, we don't bother. We just go ahead with investigation and biopsy.
Got it, doctor. Okay, doctor. Time duration, like intervals of screening, if you can just tell, like for example, if a person is above 40 or 45, what should be the interval of screening?
50. No 40 and 45, don't worry about your prostate. Start worrying about the prostate only when you're 50.
Understood. And doctor,
unless you have urinary symptoms.
Yeah. Quick question, doctor. Do we have any cases, something in the teenage or in 30s or 20s?
Almost unknown to have prostate, the classical prostate cancer in these age groups. But you have very rare forms of prostate cancer, which are not the usual ones. Like they are called small cell cancers of the prostate, neuroendocrine tumors of the prostate. These are all like anecdotal case reports. Once maybe 100 cases in the world or 200 cases in the whole world may be reported. So these are very anecdotal cases which come, very rare histopathology in younger age group.
Doctor, relating diet, food or exercise, both of this, with prostate enlargement, to stop prostate enlargement or moving towards the cancer, anything on that if you would like to say, like is diet an important part or an exercise that would really reduce the chances?
No, but then what happens is prostate enlargement per se, it's like gray hair, everybody is going to get it. Okay, it starts in normal enlargement of the prostate. It's like getting a cataract or getting osteoarthritis or getting a back pain after a certain age, Exactly. Everybody is going to get it. Now, regarding prostate cancer, there is a relationship between diet and prostate cancer. That's why I said Western diets versus, say, Indian diets or Japanese diets. The incidence is less. And the second thing is obesity and diet have been found to have people with these conditions, what we call as a metabolic syndrome. They have more aggressive cancers.
Oh, okay.
And they're also difficult to treat. It's difficult to operate on somebody who is morbidly obese. You understand? That's why the importance of lifestyle and diet in prostate cancer.
Okay, so there is always a relation, especially for people who are actually obese, towards the prostate or any kind of cancer. I should say, as you said that they're aggressive on this part. Doctor, we are in 2020, and you just mentioned some time back about the technology that we are using when it comes to surgery, when you go to a surgeon, as you mentioned earlier. Doctor, what are the latest technologies? If you can just give a brief on that to treat the prostate cancer.
At present, the gold standard is the robot. It was brought out by a company called Intuitive Surgicals, and it was the Da Vinci robot. Da Vinci, the famous Da Vinci. So, whereby you get the surgeon sits at a console and robotic arms control the laparoscopic instruments. Rather than the surgeon at the bedside holding the instrument and operating, these robotic arms, like a big bird, they'll be sitting over the patient and they'll be attached to the laparoscopic instruments. Whereas the surgeon sits at the console, which is away from the patient. He has a highly magnified 3D view of the whole operation, better than normal vision or better than almost as good as normal vision and better than laparoscopic vision. And it's magnified 10 times. And the movements, the instruments have hinges like wrists and elbows, whereas the standard laparoscopic instruments don't have wrists and elbows. So inside the body, these instruments can really work like the normal wrist and elbow of a surgeon, but within the abdomen. And the movements are very, very precise. Even if the surgeon has a horrible Parkinson and tremor, it will be negated by the robot. So it will look very smooth. In fact, any sudden movement which is made is immediately cancelled off. So you don't get accidents of an instrument going and doing something. And the most important thing is it makes surgery easy. It makes learning surgery easy. So what happens is, for example, For me, after 400 radical prostatectomies, it is still takes its toll. I have to stand for 3 to 4 hours with my arms abducted. So you get, aches and pains, and you need to take rest in between, stretch your arms. And it has taken me this much experience to reach my level where I have reached. Whereas a robotic surgeon sits very comfortably, has a cup of tea in between, is, he can walk around, pass urine if he wants and come back. And he can learn the procedure faster. Maybe within 6 to 10 cases, he can do a case by himself. Of course, there is a learning curve for robotic also, where you get better and better and better and get less complications with numbers. But learning is definitely easier than doing it laparoscopy. Now, what about, I don't know, in the future, they may have miniature robots, which they are trying now. They just make a small hole and put them inside, and they go there and you can control the surgery from a distance. So probably, and now they also do this, instead of putting 4 or 5 holes, they are doing these operations through a single hole with specialized instruments. So it's just getting more and more minimally invasive. But more companies have come now into 2020, other than Da Vinci, which had the monopoly. Now there are so many other companies. So the main disadvantage of robotics is the cost. The cost is adds an additional $1,500 to $2,000 to the surgery. And generally, insurance companies don't cover this additional cost. It has to be borne by the patient. So once the cost of robot comes down, it will be more universally available. It will be more competitive, the market, and cost should come down. Now, regarding radiation, as I said, it is a long process, 6 weeks. But now they are even getting some specialized equipments like what is called a cyber knife, where you can give high dose radiation, same effect within 3 or 4 days, to cut down the problem of prolonged course of radiation. Then there are newer treatments in selected cases where you just freeze the tumor. It's called cryotherapy. You just put a probe in the rectum, which is nearby, and freeze the prostate. Or you do high intensity focused ultrasound. Once again, a probe is kept against the tumor, high intensity ultrasound waves are passed, and the tumor disintegrates. But these are all have special indications, and probably more important patients who are not fit for major treatment. And there are also trials are being undertaken for these newer treatments.
Right, Doctor, as we are in prime hospital, Page Live, and you're practicing the prime hospital, what kind of technology we have here as you are also doing surgeries for prostate cancer?
Well, we have the latest laparoscopic equipment. We do not have the robotic equipment. One main reason being that the additional cost cannot be borne by most patients.
Right.
So the additional cost of $2,000 per case. The second thing about Dubai in general is most of the population is a young working population. You have very few people working after the age of 50 or 55.
Right.
It is mainly the local population which is still around after that age.
That's right.
So the total number of prostate cancers being treated in this country will be lower than others, because the immigrant population goes back home.
Exactly.
After a certain age, they retire and go back home for their treatment. But we have all the required equipment, expertise to do laparoscopic radical prostatectomy.
That's right. That's really great. Doctor, do we have a chance? Is there a chance, I should say, at a certain point where we do a surgery, and is there a possibility that this cancer can come back again? Or
any cancer in the body is, you can't talk about cancer cure. Every cancer in the body has to be followed up for throughout the life of the patient. Okay, we cannot say how many of them are going to come back, but in stage 1 and stage 2, the cure rate is in the high 90s. in the high 90s. And the survival rates are, I'm talking about 20 to 30 years. Like somebody at 60 is going to live till 85 or 90. If so, that's why, and also as I mentioned, prostate cancer is very slow growing. So suppose you get an 80 or a 90-year-old guy with prostate cancer, we may not even treat him because it's slow growing. That he's likely to pass away due to something else, a heart attack or a stroke, but not a prostate cancer. So the important thing to note is prostate cancer in the early stage is one of the cancers that is entirely almost curable.
Thank you, doctor. I have a question from Ms. Anita. The question says, my brother-in-law is suffering from fourth stage prostatic cancer. He is on chemotherapy and now is recommended radiation. Are they effective at this stage, fourth stage? And what would the prognosis be in case they do go for radiation?
See, in fourth stage, I assume that the unfortunate man has cancer which has spread to his bones. So when it spreads to the bones, usually we start with hormonal and chemotherapy, but some patients start developing pain in the bone, like a severe backache or a severe pain in some bone or impending fracture in a bone. It's in these such situations that we recommend radiation to that specific bone. Now that dose of radiation is much less. It may be 10 days or 2 weeks. And it is purely to give symptom relief. It is not for cure. Once it is stage 4, we are beyond the stage of cure. And the lifespan varies anywhere between 18 months to 5 years. But, medicine is not 2 plus 2 is 4. I have seen patients where it has spread to bone, surviving 15 years, 18 years, and following me around my practice wherever I've been. Yeah.
Thank you, doctor. Doctor, you've given a lot of information, and it was really, really, really very good talking to you about prostate cancer in men specifically. Doctor, there was a question saying that prostate is only for men, is it?
Yes.
Only for men. It's not found in
not found in women.
It's not found in women. That's great, doctor. Doctor, before closing up the session, I would really like to request you for a take-home message on prostate cancer, how we can avoid it, or what should be looked at in case to stop this. A take-home message from your end.
The first thing is, if you're less than 45 and you have some urinary trouble, don't Google yourself, because you will end up with a diagnosis of prostate cancer and it will give you probably sleepless nights. If you have a family history of any male member, uncle, brother, father, grandfather, brother who had prostate cancer, it is mandatory that you get yourself screened every year from the age of 50. If you are African American, maybe even from the age of 45. If you have urinary symptoms at the age of 50, like a poor flow of urine or irritation or a frequent urination, you have to see a urologist. Don't pass it off as this is just part of my aging process. You have to see a urologist and he will definitely screen you for prostate cancer. And finally, as I said, a healthy lifestyle in the form of diet and a good dose of exercise has beneficial effects for all these men's health issues.
Thank you very much, Dr. Sanjay, for taking out time and giving us this wonderful information on prostate cancer. I believe a lot of audience who have watched or heard you today will get this information, spread out further also, as this is what we want. Prime is all about personalized care personally, and this is what we do. And also people who are going to watch it later, once it's there on social media, people will get a lot of benefit out of it. I just wanted to tell everyone that currently Dr. Sanjay Bhatt is practicing in Prime Hospital. You can book an appointment with him. He's the consultant urologist, and that's the number on your screen, 0429297777. You can book an appointment with him, and if you want to consult him, he's there as per his schedule. You can meet him. If you have any query, if you really want to ask anything related to current topic of the day that we had, that is prostate cancer, you can send us an email at myprime@primehealth.ae. and we will get to Dr. Sanjay, and he will answer. I mean, and if it is really required to visit doctor, he would definitely give a response on that part. Dr. Sanjay, once again, thank you very much for being with us today. It was very great having you today with us. Thank you to everyone who were watching us, and we will be coming back to you with another live session because Prime is keen to give information, to spread awareness about all the important health topics, health issues that we should always, put out there to everyone. So thank you very much, everyone. We'll see you again. Take care. Bye bye.